Hi, my name's Sam and this is Mike. We're a part of Team SmartCath, which is a real-time blood monitoring system for dialysis patients. First, we must understand what is dialysis. Dialysis is the way that we replace the function of the kidneys. The kidney's main role is to filter the blood to remove toxic metabolites and the buildup of electrolytes in the body to maintain function and health. Who gets dialysis? Those patients that have chronic kidney disease that typically progress to end renal stage disease, when the kidneys are just not functioning enough to be able to filter the blood for the body. Who else gets it? Those that have acute kidney injury or have toxic ingestions. Over 26 million patients in the US have chronic kidney disease. Over 500 million of those, half a million of those, will progress to end renal stage disease, the incidence of which is about over 100,000. How does dialysis work? It involves first getting access to the blood. We do this by placing a catheter in one of the major vessels of the body. That catheter is in place for weeks to months and sometimes years. Later, a fistula can be placed for chronic dialysis. The blood is removed from the body, filtered through a dialysis machine, and put back in the body. Oftentimes, it can take up to 4 hours per session. So how is dialysis scheduled or started? First, we must monitor very closely the blood levels to monitor the function of the kidneys as well as the buildup of the toxins or metabolites. Initially, this is done very frequently. Later on, this is minimized and patients are placed on a schedule, oftentimes going to dialysis 3 times a week, which begs the question, are we doing dialysis too much or not enough? How come we aren't individualizing when patients go to dialysis and rather just placing them on a schedule? So the problems with dialysis are this. It takes a lot of time, takes a lot of money, and has negative health effects for both doing dialysis too much and not enough. We hope for a future at some point when we can personalize this, and we do have direct access with the catheters. We can do continuous monitoring, thereby scheduling patients for dialysis on an as-needed basis.
So utilizing the fact that the catheter has access to the patient's blood, we've placed an ion-sensitive transistor into the tip of the catheter, which allows us to monitor their pH and potassium levels. We send that data to a smartphone or computer. Combined with the patient's weight, we can determine if and when they need to undergo dialysis. The average cost of dialysis treatment is $500, and the patient usually does that 3 times a week, totaling up to $78,000 for the patient per year. We are looking at newly diagnosed kidney failure patients, which there are over 100,000 of those per year, which is a total cost of $9.14 billion on the healthcare system. If we can, during the 12 weeks that it takes for the fistula to form, if we can use our smart catheter to monitor the patient's pH and potassium levels and reduce their need for dialysis to once a week, we can save that patient $12,000 a year and the healthcare system $1.4 billion a year. Here are some additional markets where we think our catheter could apply. Thank you for your time. We hope to see you at the competition night.